Hi, I'm Robin. I'm a dental hygienist and a myofunctional therapist, and I talk about all things kids' oral health. Today, I want to talk about the benefits of early intervention when it comes to expansion. We see many kids every day in the clinic that I work at, and the majority of them have crowding and space issues. And the baby teeth, although they may look lined up nice and straight, when they're all touching together or the bite is very deep, that causes a problem when the baby teeth exfoliate and the new teeth are coming in. New teeth, the adult teeth, are bigger than baby teeth, and if there's barely space for the baby teeth, there's definitely not going to be space for the adult teeth to come in. So it's best to intervene early while the child is growing and developing. The jaws are very malleable. We can do a lot to help encourage widening and expansion of that jaw while they're very little. We are seeing kids come in with airway issues, sleep issues, behavior issues, all different kinds of things. And if we can intervene early and we can get some airway focused expansion, that can be very beneficial throughout their entire life. So we're starting with kids as young as 3, 4, 5 years old, 6 years old, and we can put some expanders in their mouth. We can get that palatal suture, which is the suture line down the center of the roof of the mouth or the palate. We can get that suture to open because it's not fused yet. Once you get to be about 12 or 13, depending on each child's development, that suture fuses. So it's not as easy to expand when you get a little bit older. So if we can get the child into expanders when they're really little and that suture is still open, we can expand the arch and not just open the teeth up, but open the actual maxilla, open that palate and get that to widen. When you widen the roof of the mouth, you're also widening the nasal floor. So when you're widening the nasal floor, then you're allowing for more airway and more better breathing and a reduction in your sleep disordered breathing symptoms. So if we can get to a child before the suture is fused, while they're little, we can get that suture to open. On this last x-ray, you can see that we've expanded that suture nice and wide, which we've gained a lot of good nasal floor expansion. And now you can see those fibers start to build up between that suture and that bone is filling in already. It happens very quickly in children. It's really fascinating, actually. So now she will wear her expander, not making any turns, and just hold that expansion until that bone completes filling in. This is going to give her room for her adult teeth to come in. You can see there's a lot of spacing in her teeth right now, which may seem a bit much, but we need that extra spacing so we have room for the permanent teeth and because we're trying to expand the palate and that nasal floor. So once she starts losing her baby teeth, she'll get her adult teeth in, 6-year molars, and then those front 4 teeth, they're going to fit beautifully because they have lots of space. And then we can reevaluate again when her canines are trying to come in to make sure that they're going to have adequate space. Sometimes we have to do another round of expansion to make space for the next round of permanent teeth to come in. And then when she's all said and done, all of her teeth will have been able to come in their proper space. And then there's less need for more invasive orthodontics later on. The idea behind that is all of the teeth will then be where they belong in the bone, and you'll have less chance of having things like dehiscence, fenestrations, and recession. You'll also have less chance of recession because these teeth came in where they were meant to come in. We were changing the skeleton, not just moving the teeth within the fixed skeleton. So we can eliminate as much invasive need later for orthodontics and try to reduce the relapse risk as well. So once we're all said and done, if there's any minor tweaking that needs to be done, we can look at aligners or a few brackets for short term just to get those straightened out. But for the most part, things will come in where they belong. So that is our goal. That is why we are intervening early. If your child is having symptoms of sleep disordered breathing, very restless sleep, waking moody and very tired even after a full night's sleep, mouth breathing is a big one. We really need our kids to be nasal breathing. That's where we get our parasympathetic involvement. We get rest and digest, less anxiety, less problems with behaviors, better ability to focus. So if we can intervene early, it really can help kind of clear up some of those symptoms as well. So we're not just addressing teeth, we're addressing the skeleton. Let me know if you have any questions.